It says Kerala has topped the maternal and child health indicators according to a sample registration system. This sample registration, I am deadly against this kind of sample surveys where you don't even tell how many people have been surveyed properly, and the way surveys are conducted, even your census. Friends, we have an important issue for all of us, even for common man. I have already devoted some time to studying tribal education and health, and my book, it has uh, almost 60 pages on health. And here we have the new statistics. What does it say? It says Kerala leads the nation in maternal and child health. It says Kerala has topped the maternal and child health indicators according to a sample registration system. This sample registration, I am deadly against this kind of sample surveys where you don't even tell how many people have been surveyed properly, and the way surveys are conducted, even your census. Like I have seen when I was studying Uttarakhand in Vetragarh in 1978, 79, 80, something like that. The surveyors, they won't go to the villages located at high altitude. They would sit on a charpai in after SEAL headquarters, call somebody, fill up the details of all the villages. So I don't think we can rely on anything studied by the state. The southern states have already, this southern state has already met 2030 health targets set under SDGs in all the three key indicators: death of mother during childbirth, newborn deaths, and death of children under 5. The state's current numbers: 20 maternal deaths, 4 newborn deaths, and 8 under 5 deaths per 1 lakh, or 1000 births, well below the target of 70, 12, 25. Then besides Kerala, 7 other states have kept maternal death during childhood below the target of 70: Maharashtra, Telangana, Andhra, Tamil Nadu, Jharkhand, Gujarat, and Karnataka, with Maharashtra recording the lowest amongst them means otherwise this. In contrast, the national average of maternal mortality ratio is 23 points above the SDGs, despite a nearly 30 points decline from 130 deaths per lakh live births 2014-16 to 93 deaths as reported in the SRS 2021 report. Similarly, based on the insights from the Health Ministry, the country has seen a further 36.8% reduction is still needed to reach the SDGs target of 12 or fewer deaths. Meanwhile, fewer states have managed to meet the SDG target for neonatal mortality, as per again the same. Delhi ranked second with 8 deaths per, compared double to that of that, but still very low. Tamil Nadu, Maharashtra follow in third and fourth, and then blah 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 blah. Despite the need for further improvement, India's progress in reducing maternal and child mortality has so far outpaced global averages, as stated. This is what they claim is an achievement. The question is, even if one death is there, why should there be? If there are 8 deaths in Delhi or 4 in Kerala, why should there be? In a place like Delhi, Kerala is considered quite advanced. Why should there be deaths? They give no reasons for that. And that is the irony. The way your health facilities are there, just count the number of doctors per lakh population. It is hardly 6 or 7 or 8 or 9, single digit. Number of nurses, again single digit. How many medicines are available in primary health centers? You are very clear about it. You never talk about the facilities available. You never talk about the manpower involved. You never talk about the need for specialists. You never talk about funds. So that way, if you continue, how much time will it take to make all the figures zero? That is, I think, too much to expect from a country like India. Health is not a priority for the government, for the bureaucracy, for the politicians. Otherwise, bureaucracy can do a lot. I am telling you from my own experience. I was studying Birhor, the PVTGs. I was in Giridih, in Jharkhand. Diprav Lakda was a collector, a student of mine, and who had a bit of anthropology knowledge also. Originally Punjab cadre, but took definition to Jharkhand. And what is the 2011 census that says this is the population of Birhor, total 490. But when I studied, I went the pockets in a village. The pocket of Birhor is called Tanda. When I visited all the 5 of them personally to each house, I counted the number 557. That means that from 2011 or 2010 to April 14, when I took, the population has increased to 557 or 46%. Is it possible? It can never be in any community, it can never be. Then about the mortality of the mother and the infant and the neonatal, not a single death was reported in the 3 years Diprav was here. You have, again in the 5, these children were born and no death. Even expectant mother, even at the time of childbirth, and even the children. How it could be possible? This was the vigil of the administration. Actually, each village, it was 10 to 15 kilometers far off from the roads, Pakka road. Now, of course, I hear that Jharkhand government has done a lot in constructing roads. But ASHA and other auxiliary workers, plus the NGOs, each tanda was taken care of by a person from any of them, and one of them had a bike with them. Any problem, and the person would take the affected person to any nearby primary health center. So if the Diprav can do, anybody can do, the government can do. You can say that this is a small size. I agree. But if collector has taken so much care of the PVTGs, do you think he must not have for his district as a whole? And if bureaucracy can take care of one district, then every district can be taken care of. Simple way is accountability and transparency. If a collector demands manpower, specialists, medicines, health workers, the state must provide. But the state never does. I told you, health is not a priority for them. But health is not merely health. Health is associated with employment. How can you be employed if you are not proper healthy? Health is associated with education. How can you think of having proper education without health? And how can you have good health without proper education? And how you can have good opportunities in employment without these two, both of them? Again, health, education, employment got to be priorities of the state if the country wants to develop. I've already told n number of alternatives. First thing is, all the Manrega works other than supplying drinking water, pure drinking water to all the hamlet, within a year you can do it. You will not. So many people are ready to help the state in health and education, but the state has its own rules. It creates more harassment to the people who want to help. I'm one of the agreed persons that way. Anyway, my issue is different, but no need to be proud of Kerala in that regard. Every state has to be, whether it is UP, whether it is Bihar, what you called Bimaru states, nobody should be left out with respect to health, education and employment. Please think and please promote. Let the bureaucracy be awakened. Let the state be awakened. Let your politicians who come to you for vote, let they have some good sense with them, and let the country be healthy. Thank you.